Back in the 1970s, before I was ever a respiratory therapist, I worked in an anesthesia research lab. Our research centered around the online monitoring by computer of respiratory mechanics. Our tools were quite invasive. All our patients were intubated, and they were all instrumented with an esophageal balloon. The technology has been upgraded considerably since that time. Now, in 2017, we can do the same thing non-invasively using a zero-impedance pneumograph. This device uses electrodes attached to the chest to measure geometric changes in the chest cage, and after calibration, we can continuously and online measure respiration, specifically tidal volume, respiratory rate, and the arithmetic product of those two parameters, minute ventilation. In this module, we will explore the concepts and principles of respiratory volume monitoring. And the modernization of these techniques couldn't come at a better time for respiratory care practitioners in general, and for RCPs who work in California in particular. Just last year, the California Respiratory Care Board broadened the scope of practice of respiratory therapists in California to include conscious sedation. So we will focus particularly on respiratory volume monitoring in patients who are subject to post-opioid respiratory depression.